Hello, friends. Good evening. Today, Team Integrated Homeopathy is going to share a wonderful case where we are going to demonstrate aphorism number 3 of the organon of medicine. So we will be talking of the various knowledges that every physician requires in treating a case. So aphorism number 3 clearly states that if the physician clearly perceives what is to be cured in disease, that is to say, in every individual case of a disease, that is the knowledge of medicine indication. So when a patient comes to you with whatever presentation of his signs and symptoms, you should be very clear on what is the clinical diagnosis of the case. What is the causative factors of the case? What is the pace of the disease process? What is the pathogenesis that is going on? And what is the prognosis of the disease? So once the physician is well equipped in handling all these aspects of the disease process, then he will be in a better, he'll have a better armamentum to handle any difficult and challenging case. It also states if he clearly perceives what is curative in medicine, that is in each individual medicine, knowledge of medicinal power. Our chest box is full of thousands of homeopathic remedies, many of which are proved, so we know the action of most of the remedies on the mind and the body at the physical level, particular level, as well as pathogenesis. It is so important because if he knows how to adapt according to clearly defined principles, what is curative in medicine to what he has discovered undoubtedly morbid in the patient, so that the recovery must ensure, to adapt it as well in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him. So this clearly talks about the law of similars, the choice of the remedy and the medicine indicated, because nothing is to be observed in a disease that must be removed in order to bring it to health, but the totality of the symptoms and signs. And likewise, medicines can show nothing curative besides their tendency to produce an artificial disease process and to remove them in a diseased person. So we are talking about drug proving and applying the law of similars in any patient. Also in respect to the exact mode of preparation of and the quantity of the required dose and the proper period of repeating the dose. So it is so important that we are very clear about the handling of the posology, which depends on the susceptibility and the sensitivity of the patient so that the disturbed vitality comes into its normalcy. And finally, if he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judiciously and rationally. And he's a true practitioner of the healing art. So our team is going to demonstrate through a case all how they have applied all the knowledges. So I welcome the team and I welcome Dr. Anita Bajaj to present her case.
Good evening, friends. Today I'm going to present one acute, and that too neurological acute. So, it is very difficult to treat when there is a neurological emergency. A lot of anxiety is there in patient as well as in the physician, because the symptoms are so alarming that there is always that fear of having, a very severe disease like paralysis, stroke, which can lead to permanent inability or disability. So it is very, very, important to have your knowledge at the same time to take patient into confidence, reassure the patient, and be confident yourself that you will be able to handle the situation. So my journey in this case started with confusion, but definitely as it went ahead, there was clarity and there was confidence in treating the case, and there was a lot of satisfaction in treating this case, because had he gone to other system of medicine, he would have been hospitalized, investigated extensively, and finally there was no cure in any other system of medicine. I'm not taking any names, but in homeopathy we definitely have medicines for all types of diseases. We should know the scope of medicine, and we should be confident to apply all the principles in a very proper way. And we should have clinical knowledge also, so we know where to stop or where to seek help from specialists. So in this case, we will see all these concepts, and we will also elaborate more on potency selection in acute diseases, potency and repetition, which generally we see in our sessions, and in any other seminars also. A lot of people have questions about posology. So today we are trying to, focus on general principles of posology. So let us start with the case. I will share my screen. This patient, he is my neighbor. He is in early 50s, like late 14. He was 49. He just became 50 this year. So his whole family comes to me for treatment. They stay in my building only. He's my neighbor. So he called me up in the morning. My clinic time is from 9 o'clock. So around 8:30, he called me up that he was feeling some imbalance or some abnormal sensation, and he wanted to talk. So I have maintained his chat so that we get the, chronology or the time axis of how complaints evolved. So this was his first message on March 17th, 2023. Numbness in hands and legs, less stability in body movements and walking. Felt this yesterday also. Thought it is tiredness. Some kind of attack on nervous system. Now see what type of language he is using. Some kind of attack on nervous system. Will you give some SOS medicine? So by then I had already left for the clinic. So I told him, I had messaged him earlier also that you take one medicine was there in stock with him. So I told him to take that medicine and let me know. And I said, I don't think it is serious. So still I wanted to confirm whether it is, any acute emergency. So I told him to do video call as I was physically not present. So see, you should have this quality that you should know what your patient expects from you. So without seeing, if you tell patient not to worry, he will never be reassured. So that is the reason I told him to do video call. At the same time, I will be also sure that I am not missing out on anything. He's 50 years old. He doesn't have any history of blood pressure. He doesn't have any history of diabetes. And the problem was that from last year, they were going to shift to a new house. So they had bought a new house, and lot of, interior work was going on from a long time. So it was a very stressful period for them, as interiors were taking long time. They never used to come on time. Budget had overshooted. So a lot of multitasking. He had to attend to that work. At the same time, he is working, he is a chartered accountant. So at office also, he was handling a major project. So a lot of stress was there. And as the work was nearing completion, they were also, confused whether to keep puja and call everyone, invite all relatives and neighbors and everyone, or छोटा सा पूजा रख के पहले ये start कर देते हैं, क्योंकि some finishing touches were still remaining. So all that confusion was there. Which relatives to call, which relatives should not be invited, as they may create some issues later. So all this confusion was going on in their mind. So this is a stressful period, you see. And that too going on for a long time, about 10 to 12 months. So I was, little stressed about that also. like this type of stress can lead to hypertension or stroke or something. So I told him to do a video call. So on video call, I made him do all types of movements. Open his mouth, open and shut your eyes, speak, put out your tongue, all raise your hand, raise your legs, made him walk. So I did a neurological examination in short, and then I was convinced that there is nothing wrong in all these things. So I told him to take that medicine just to reassure him. I was not sure of the totality, and I called him in the evening. So in the evening when he came, as he entered my cabin, he told me that I think, I feel like a drunkard. I don't have any control on my legs and I'm walking like a drunkard. Uh, and I'm feeling high. So I was not getting this high word. Basically, he meant that he was walking like a drunk person. So that is why he used that high word and he was laughing. So I was wondering, no, what is happening? If he is developing some emergency, why he is laughing? And 2 days back was Holi. And last 2-3 years, always after Holi, he used to have complaints because he used to have bhang. So that was one more confusing point in that I felt when he's saying that he is on high. So I was thinking cannabis ka kuch to bhang ka to kuch asar nahi hai uska. So I was thinking, I was confused with that. But then he said he is not able to walk. So I was wondering, I checked him. There were no abnormal, findings. So I gave him some medicine. And next day morning, he called me that he is not able to hold the brush and brush his teeth. So this was something, alarming. Like why he's not able to hold his brush. Then he said, I'm not able to eat with a spoon. Then he said he was not able to, do some work with hands like signature or writing. There was difficulty in writing. So gradually these symptoms are developing. So he only said that his uncle had died of Guillain-Barré syndrome. So he just, mentioned that is it Guillain-Barré syndrome. So that time it struck me that whatever symptoms he is describing of tingling, numbness in hands and legs, there is, incoordination and grip is suffering. So I took references and I came to, this conclusion that he may also be having GBS. I had not had any experience of treating GBS, but I had definitely heard about it and the symptoms matched. So I told him that we will take neurological opinion. But since, it was progressing, but there were no motor function loss. It was more at the sensory level. So even holding the brush, he was not, because of numbness, he was not able to get the feeling that he is holding something. So that was one of the factors. He was not, having motor difficulties. I made him hold my hand, check the pressure of muscles, strength of power of muscles and all that. So everything appeared to be normal. So I told him we will take neurological opinion. So that was a time when his parents had come for the puja. They had had puja just 2 days back. So in front of parents, he was not, showing that he was suffering so much. He was keeping it at low key. So after his parents left, then next day morning, he just collapsed. He felt that now I can't do anything. So I am just going to take rest. So that whole day he took rest. Now this is the development of 2-3 days only. March 20th, I sent him to neurologist. Neurologist did all the examination and everything. He called me. He said, there is nothing much I feel, but still since tingling numbness is there, we should do nerve conduction test, EMG and all that. So we went ahead with that because already that diagnosis was there in the mind that it can be GBS and his uncle also had died. So anxiety was also there. So they did the tests. There was minimal demyelinization signs. So he prescribed steroids. But patient somehow did not like that doctor. So he asked me for second opinion. So I referred him to one more senior neurologist. He visited him also. Fortunately, the senior neurologist said, yes, it is GBS, but appears to be moderate, mild to moderate. There is no motor symptom, so we can wait. So no need for giving any steroids, nothing. So that way, we were sorted that we can only give homeopathy. There is no problem. So this is going on, all the investigations, as they manage, they prescribe all the investigations to be done. So CBC, ESR, blood sugar, lipid profile, everything was done. All the reports were normal.
Make it full screen.
So all the reports were normal. But next day, when they wanted to report to the doctor, he was not available. By then, numbness had reached his perianal region. There was difficulty in walking. There was difficulty in urinating and passing stool because he was not having sensation. And so he was little scared. So in the afternoon, he told me that doctor is not available. So what should we do? So I called him in the evening. At that time, he was also having chest heaviness and he was having little difficulty in breathing. Though I examined him, I found him very comfortable when he sat, he talked to me, he walked. There was no discomfort. But again, at the back of the mind, uncle's case was there. So he had anxiety that it may be that breathlessness may be because of, chest muscles getting involved. But fortunately, I could make out that there were no motor loss. So chest also, I did not, think that chest muscles are involved. It is mainly because of his anxiety only. So that was the time. And that doctor had told him, as he was not available, if you feel any emergency, we will admit you. And then we will give that immunoglobulin treatment and steroids and everything. So he came to me on 23rd night. So he just came and sat. And he told me, I have talked to my mom. His mom is a lay homeopath. So she reads books and gives homeopathy. She is from Calcutta. So she has told me, you tell Anita only to do whatever you want. We are not going anywhere. So this patient just sat and told me, now, madam, you only have to do whatever is to be done. I am not going anywhere. So in that situation, it struck me why he's saying like this. So all this time, focus was on clinical totality more. So I had given him medicines like Conayam, Cocculus. But then somehow, when he said that emphatically, now you have to do something. So at that time, everything, all the past experiences with this patient and everything came up in my mind. So I felt like I have, found the simillimum. So that time I was very confident. I prescribed the medicine in 1 m, told him to take 3 doses in dilution every 10 minutes and report to me next morning. It was night. They were very anxious. Raat kaise beetegi? Will he have any difficulty in breathing and all that? I assured him, I'm there, don't worry. You call me if there is anything. Next day morning, he called me. He said that chest uneasiness is not there. He was not sure of any other improvement, but he said something I'm finding positive. So there is some change and there is no aggravation at least. So I told him, we will continue this medicine. And I went on repeating this medicine in dilution 4 hourly. So we will see this case further. Now, this is the email which he wrote to me after he was better, and I told him that you write down the testimony. I just want, if I present this case somewhere, I can show it. So he wrote in detail everything about his history. So why I'm showing it here is because, it shows the mental state of a patient, what he understands about his disease and how he presents it. So I will read it. He is writing about the neurologist. He recommended me to immediately get admitted, and he wanted to do a series of tests, including nerve sensitivity, EMG, spine insertion, that is CSF, to extract the protein level in the spinal fluids. They would put some steroids through IV fluids over a period of 2 days. By the end of that discussion, my head was spinning. See, this is the handling of a neurologist. My head was spinning, and I could make out that my wife is anguished and scared to her bones on what is in store for us. And that too so suddenly. So I just want to show how anxiety of neurologist or how handling of a physician affects mental state of the patient, and which can lead to, aggravation of the disease because of the anxiety. Somehow I had an internal feeling that the neurologist may be trying to fleece me by trying to unnecessarily scare me. I certainly did not want all the steroids inside me. I immediately called Anita ji, and she asked to get out of there. Still, the doctor insisted to do a preliminary test in his chamber, which I agreed to. The results also showed that there was a case of nervous disorder. Anita ji advised me to stick to homeopathy and consult another experienced neurologist before deciding the specific course of action. We were quite disturbed mentally since my condition was not improving, but Dr. Anita advised that your condition is stable and not deteriorating. Now, from where this confidence comes? So here, your understanding of susceptibility, sensitivity is very important. Now, I saw this person strong, in that strong state of mind where he was throwing the symptoms, disease was progressing fast. So all these are signs of high susceptibility. So that is the reason, I was confident that disease is not progressing so fast. His vitality is good. He will be able to fight with the disease. So that is why I told him that don't worry, nothing will happen. Still, we went ahead and consulted Dr. Shobha, who advised me that the large motor muscles are in good condition even after 7 days into the disease. Be observant if the condition is deteriorating, else condition is expected to improve slowly. Fortunately, the senior doctor, reassured, so we were even more confident. He even advised to discontinue oral steroids. Anita ji then started a higher dilution medicine, which was more constitutional than disorder specific. Now his understanding. As she later explained to me, your regular and relentless follow-up and comforting me and my wife to overcome the anxiety over the next 1 week, the medicine continued, and we were speaking at least 2 to 3 times every day, was meeting almost every day. I took leave for only 2 days. So with this disorder also, he is working. So even this point is important. Slowly, the tingling reduced in the upper limbs. The walking also improved. However, the fingers and toes continued to be a worry factor. After about 10 days, I was also to sign and hold a pen. A very large multi-crore transaction was taking place on 23rd March. I was responsible to complete it that week before 31st March and sign all the documents over 200 pages. So see the anxiety for business, for work. Tension on that were also looming large and occupied prime space, but I was able to execute those in time. All this while the tension on the house shifting remained. So he's describing all the states, packers and movers came. Generally, he is responsible for doing all this work, but this time it was, happening in front of his eyes, but he was not involved. Wife was taking charge. He had taken back seat. And he was very sensitive to screeching noise. So see the sensitivity also. Sensitivity had increased multifold. So again, he describes about the money which he received for the flat which he vacated. There was slow improvement, but transformation was truly magical. tingling in the fingers and toes took about 2 to 3 weeks to completely go. And I was happy to start my walking and running by mid-April in the new house. So everything started like I shared in the past previous things. 17th March it started, and by mid-April he was out of it. So before even 1 month passed. So this is the case. Now we see the reports. In reports, what is important is neutrophils are high, 14,460. Generally, GBS occurs after infection, which can be viral or bacterial. So here, the reaction of body to this infection is also quite good because WBC is high, it is not suppressed. Neutrophils are high, that shows acute inflammation. This is the nerve conduction test report. Patchy generalized asymmetrical sensory polyneuropathy. So we will go to what is the metaphysics of GBS. Being attacked by destructive forces like bacteria, viruses, and surroundings. So we won't restrict to bacterial infection or viral infection, but we will also extend it to forces which can attack like the surroundings or the problems which are, attacking the person's sanity or stability. Second is betrayal, deception, broken trust, unpredictable things happening. So now we are seeing when this interior work is going on, a lot of unpredictable things are happening. It's not happening on time. It has overshooted the budget. So he has to make arrangements. They are still not very clear of whether to conduct the puja and all that. Too overwhelmed, numb and paralyzed and helpless. Now, if you see this, when this disease started, he had to slow down. He was not, involved in the activities so much. So the stresses are so overwhelming that the person becomes numb and paralyzed and helpless. So in this state, we see how we can take the totality. So now in this totality, I have taken everything. Because it is a deep disorder, there is no acute local totality available. So now I have to resort to whatever I can gather about the case. So cares full of towards parents, children, wife. He pushes them to eat fruits, walk, take care of their health, read newspapers, be updated. He is careful about his own health and expenses because he was reporting 2 to 3 times in a day, every day meeting me personally. Otherwise also during acutes, he is always on call. Like he calls me up every few hours to ask what is to be done. Very regular follow-up. Fastidious, planning, programming about work projects. Perfectionist, not compromising on quality. Punctuality, anxiety, health, which leads to prompt actions. Fear of death because of history of uncle dying of GBS. Then chest symptoms coming up on 23rd when I prescribed the medicine. Uneasiness causing panic, immediately wanted to see me and leaving everything on me. This had struck me, it is like patient wants to be carried. You do whatever you want. You have to cure me. I leave everything on you. So I'm putting my weight on you. You have to carry me to the recovery. So that is how I interpreted it. And that was my entry point. And then he also used to consult Vastu consultants and astrologists. Once I had a very, dialogue with him about this, and I asked him, are you superstitious? So he said, I'm not superstitious. But if I can get benefit by consulting Vastu and astrologer, then why not? So this shows, his greed. And this shows his theorizing also, that and business aptitude also, where he wants more profit. So acute totalities and frequent follow-ups. in acute totality also, generally he gives frequent follow-up and he has this carried desire to be fast. Now I'll tell you, last 2-3 acutes whenever he had, just before this illness also, 1 week back he had throat infection which had responded very well to arsenic alb. And that time also arsenic alb was prescribed on phone as I was out of town. And business talking about, because he was worried about his work, he had to sign so many papers, he had to finish that deal and everything. And he missed only 2 days. With all these things happening, he just missed only 2 days. And he used to get up early morning to finish the work. So taking all these into consideration, the remedy that comes up is arsenic. Now you will ask, whether arsenic has any action of CNS or peripheral nervous system. So there I would say, so whatever totality you get at general level and at the mind level is more important than what you get at the local level. And local are all disease pathological symptoms, so we don't have to give any importance to it. What is more important is characteristic response of this person to the situation. So I prescribed arsenic alb, and posology being susceptibility being high, sensitivity being high. It's a nerve pathology, acute autoimmune destruction. So tuberculosyphilitic miasm, vitality is good. He is moving, he is working, he is doing everything. So with this similarity and proven confidence on remedy in last 2-3 acutes, so I resorted to high potency, frequent repetition in dilution because I have to control the disease progress. As you know, he had developed this chest uneasiness also, perianal numbness also, difficulty in passing urine and stool because of perianal numbness. So I thought I have to be on my toes. I have to control this disease progress anyhow. So I started with 1M potency and next day he started, getting better. So chest uneasiness was gone next morning only and he went on improving steadily. 23rd March, arsenic alb started. 1 dose in dilution at night. Next day morning registration, gave BD in dilution, later BD to TDS depending on anxiety level and tingling. And in 2 days he was able to brush. He was able to write, sign. Perianal tingling had gone. Until 30th March, almost 80% better. After that, I had stopped the medicine, given him arsenic alb 10M. In stock, but he did not need it for at least, 1.5 weeks. He was off medicine. He was just given SL. So this is the case. So I will invite Nirupama to talk about this disease.
Yes. Shobha, you have to allow me share screen.
Yes, Nirupama.
So Guillain-Barré syndrome, commonly called as GBS. So friends, it is a neurological disorder, as we all know, but it has autoimmune aspect. So it's an autoimmune disease that can develop after an infection, which affects the peripheral nervous system, leading to tingling, numbness, weakness, and paralysis, which happens in months and remains for years. Peak develops within 4 weeks. In 50% of cases within 2 weeks, and in 80% cases in 3 weeks, the peak symptoms develop. So there are various types of GBS. One second. So GBS often appears after respiratory infection or gastroenteritis. food poisoning, and sometimes it happens after vaccination too. Symptom starts within few days or weeks after the infection. And it is very important to understand that it is not inherited and it is not contagious. So what happens in the disease? Damage prevents nerves from sending information, that is touch sensation to the spinal cord and brain, and in return, even message doesn't come to the body. So what happens? There is a lot of numbness and weakness of the muscles. And people of all ages are affected, but mostly seen in adults, and that is too in males. Most people recover fully. Even very severe cases of GPS, they recover fully. Severe cases of GBS are rare but can result in near total paralysis and problems in breathing. There are various types of GBS and there are various types of presentation. There is not a single way it comes, but you will see various forms. Most commonly, we see acute inflammatory demyelinating polyradiculopathy. This is very, very common, where weakness starts from lower part of the body and gradually moves upwards. Then there is a Miller-Fisher syndrome, 5 to 10% of the GPS. What happens? Here again, there is problems in walking and in balance. In this Miller-Fisher syndrome, eye muscles also gets affected, and very rarely it can start from the eye problem, but that is very, very, very rare. Another rare form is acute motor axonal neuropathy, where there is sudden weakness in the limb starts, and along with that you see the breathing problem. Then acute motor sensory axonal neuropathy, which starts with the sensory changes, that is tingling and numbness. Sometimes comes very slowly, and then they develop the typical symptoms. Multifocal motor neuropathy, where weakness comes in some muscles gets affected either in arms or in legs. Then chronic inflammatory demyelination polyneuropathy, where there is a period of weakness recur over a number of years. So what are the symptoms? Symptoms typically last few weeks, with most individuals recovering without long-term severe neurological complication. So there is no severe long-term neurological issues. First symptom of GBS includes weakness, tingling sensation, usually starts from the legs and then it spreads upwards. Paralysis, it develops paralysis of legs, arms, muscles of the face. In approximately 1/3 of people, chest muscles are also affected. Our patient was also feeling weakness of chest muscles, making it hard to breathe. The ability to speak and swallow can also get affected in severe cases. These are life-threatening cases. So most people recover fully from even the most severe forms of the, although some continue experiencing weakness. Even in the best settings, small number of GBS patients die because of complications. And what are the complications? Paralysis of the muscles of breathing, blood infection, lung clots, and cardiac arrests. Oh, what happened? Symptoms, not always, but relatively, you see symmetrical problem. This, I told you, peak reaches in 2 to 4 weeks, and then there is a plateau, and then the recovery starts. Permanent sequelae are also possible. And usually in CSF examination, you see elevated proteins, which usually you see in second week, not in first week. And nerve conduction study shows the slowing of the conduction in 80% of the cases. So that is about the disease aspect. And now Dr. Shobha will explain the posology part. What are the criteria to select right potency and right repetition?
Sharing my PPT.
Yeah.
So, yes, friends, posology is very important. And as we all know, that after every lecture, that we listen, like there are always doctors, who are asking about, okay, what is the potency which was given? How frequently the medicine was repeated? So it is not only coming to the simillimum is important, but the posology, the potency and the repetition also is very important in each and every case for the doctors to know and understand. So that is why we have decided, to discuss about the posology, the general guidelines. In our principles of organon, there are clear-cut guidelines given on the basis of which we can decide about the posology and the potency and repetition in each and every disease. Now, this can be taken as a complete separate lecture also, which we may take in future sometimes. But today, at least what I am going to do is, in short, the general guidelines of the posology. So the potency and a selection and the repetition of the dosage is also very, very case individualistic. And it differs from case to case, just like the way the selection of the simillimum is very individualistic, depending on every case. And there are two major factors which helps us in deciding the potency and repetition. And they are the susceptibility and the sensitivity. Now, what is susceptibility? Let us understand what is susceptibility. So the susceptibility is an inherent capacity of every living being to react to the stimuli in the environment. And from this reaction, we can make out whether the susceptibility of the living being is high, medium, or low. And there are definite factors from which we can decide whether the susceptibility is high, medium, or low. So suppose when the case comes to us, and if we see that there are good level of similarity between the remedy and the picture which is presented by the patient, there are good characteristics available in the case, if there are strong mentals available in the case, if there is a functional reversible pathology, meaning the pathology, whatever the patient is having, it can be completely reversible after giving the medicine, and there is a good general vitality of the patient. Now, what is this vitality? When we see that the patient is very alert, very conscious, the general parameters like, the blood pressure, temperature, respiration is also, pulse is also very much into the normalcy. Then in such cases, we say that, the susceptibility of the patient is comparatively, it is a high susceptibility. And in such cases, we can go for the medium to high potency with a very infrequent repetitions, and we can handle such cases. Similarly, when we see that the patients who are coming to us, they are coming with no much characteristics available in that case. There are very poor indications, or we find that it is difficult to match the similarity between the remedy and the picture of the patient, or patient who presents with more of the disease symptoms and less of the individualistic symptoms. In every case, we find that there are group of symptoms which are related to the pathology and related to the disease. So they are the disease expressions. Now, when we see this disease expression, it tells us about the disease and not about the individual. Whereas in homeopathy, to prescribe what we know and what we should stand more on to are the individualistic symptoms of the patient, which characterizes the patient as a person. So when we see that if there is a paucity, there are less of these symptoms which are individualistic and more of the in pathological symptoms or the disease symptoms. And if the pathology is a structural and irreversible, and there is a poor vitality in the patient, and that time we think that the susceptibility is low and the potency which is required is also low and with a frequent repetition. So we need a frequent stimuli to stimulate this susceptibility. Now, similar to susceptibility, there is a very important role which plays to decide the posology is sensitivity. And how do we decide about the sensitivity? The sensitivity is usually decided on the basis of the sensitivity of the mind and the sensitivity of the nerves. So if the sensitivity of mind and nerve is usually high, and if the pain intensity is also high, the pain of the, meaning the mental and the physical, mental and physical pain at the level of the mind. For example, we get the irritability, the agony in the patients. There is a lot of rage when along with the disease. Then we can say that the patient's sensitivity is very high. At the same time, at the level of the physical, they get the intense pains and the complaints are very intense. Then also we consider that the patient's sensitivity is high, and the potency which is required will be high potency with infrequent repetitions. And if, when we call the sensitivity being low, that when we feel that the patient is mentally not that sensitive, their insensitivity which has been seen, or we see the physical painlessness of the symptoms where we are expecting some pain to be there present, but it is absent, and in that place we are seeing that there is a painlessness. Whatever is expected, it is not there. In such cases also we consider that it is a low sensitivity of the person, and we require frequent repetition in such cases. Now, if the susceptibility and sensitivity is medium, then the potency which is required will be medium, and in such cases the repetition should start from infrequent and then go towards the frequent repetitions. Also, the disease, the type of the disease is very important to decide about the posology. Say, for example, if there is an acute diseases in which we know that the onset is very sudden, the pace of the disease is also quite fast comparatively. So in such cases, restrict the progress of the disease, we require a higher potency with a frequent repetitions, the way we saw in Dr. Anita's case today. And if there are chronic diseases, which is the disease is chronic, which has a gradual onset, and the pace of the disease also is quite slow, in such cases we can opt for the medium to low potency, and we can start with the infrequent repetitions going towards the frequent repetition. In some cases of allergies and hypersensitive reactions, the reactions are very hyper. In such cases, we can think about the medium potency, but we also have to repeat it with very caution. We have to assess the remedy response from time to time, and then infrequent repetition is sufficient enough in such cases. Now, if we get a pathological cases in which there are severe irreversible changes which has happened, and we want to repeat the dosages very frequently, you need a frequent stimuli. In such cases, we can go for the LM potencies. Now, why LM potency is? LM potency can give rise to, LM potency has more of dilutions. And because of its more dilution compared to the centesimal potency, here we can repeat the dosages more frequently, comparatively easily, with less chances of medicinal aggravation coming up. So that makes us little at ease, the physician also a little at ease in repeating the dosages. We do not get much, we do not come much under the tensions. Even similarly, if any other disease which is there, which is requiring lot of multiple stimuli and frequent dosages, there also we can give LM potency with frequent repetitions. Suppose a need arises to give a nosode in any case. That time, the nosodes usually are preferred to be given in a higher potency, but in frequent repetitions. Also, at times, in some cases, we require to give organ-specific remedies. For example, while treating the diseases like cancer, nowadays the cases of cancers are increasing a lot, and we are seeing very good results with homeopathy also, which is helping the patients a lot. But in such cases, sometimes if we feel that there is a cancer of, say, breast or say prostate or liver, and we want to give those medicines which has the tissue and the organ affinity, which are having a good actions onto those specific organs and the tissues. So they are called the organ specific remedies. But when we are using these organ specific remedies, that time the similarity is at the level of the tissues and the organs. So that is why it is preferable that we should go for a lower potencies, but the frequent repetitions. Also, the age of the patient matters. And the way we see that if there are patient who is coming to us are the children or the young adults, then in those cases, like usually their general vitality is comparatively good. So in these cases, we can go for the medium and high potencies, but with infrequent repetitions. Whereas at the same time in geriatrics, when the patients are of an old age patients who are coming to us, that time the potency can be low and with the frequent repetitions because of their general vitality being low. Now, the 3, 6 and the 12 are the potency we consider as low. 30, 200 we consider as a medium potency, and 1M, 10M, 50M and CM as a high potencies. Now, friends, with this, we also need to keep few things in our mind. Anita, next. That once an adequate response is observed, the further repetition of the remedy should be stopped. And as long as the response continues, the remedy should not be repeated. With this word of caution, like, these are the general guidelines that I have tried to give to you people about the posology, about the potency and the repetition. We are sure that it will help you, but how to, apply this in a specific case, that we will now try to see. We will see that how Dr. Kushala will help us telling how we can apply in this specific case the general principles. Yes, Dr. Kushala?
Yes. I think where the case was concerned, Dr. Anita has already given her posology. What I felt if we take in today's discussion into consideration, the points which come up very, very prominently is, first of all, the role of the physician in handling a case. How physician has to have his sound senses, an unprejudiced observer. You have to be mentally, intellectually, emotionally in balance when you're treating such life-threatening conditions, because the patient looks at you for confidence, and you also have to have the confidence in the knowledges that you have carry with you. So first is the role of the physician, which I felt was very important in today's discussion. Second is handling the family dynamics. I mean, when you're treating cases like GBS, it can shake anyone up. It shakes the family dynamics. So handling of the family along with the patient and giving that constant empathy and reassurance played a very vital role in this case handling. Second is the role of, the disease. I mean, what is your understanding of the disease process? Like as Dr. Nirupama gave the types of diseases, the pace of the disease, and the threatening life conditions where, people have died of paralysis of the respiratory system. So in this case, what has happened is, at least Dr. Anita was, doing on examination findings where she was able to determine ki, okay, it's not at the motor level, but it's more at the sensory level. So it's not that threatening, that I can, with my understanding of susceptibility and sensitivity, and with these characteristics which are thrown up, I will be able to handle this patient in repeated doses. So this is where the role of the disease process is concerned. And then your medicine, your confidence on your medicine, on the characteristics of the totality which comes up, because the patient is, you have already given your chart, Dr. Shobha, where you have given the certain criterias, where this patient, his vitality was good, his susceptibility was high, he was throwing up characteristic mentals, his sensitivity was high, and he had the confidence of the physician, because of which, that 1M and repetition helped. So these guidelines of the posology, along with the understanding of the disease process and the various knowledges that we carry with you, I think any life-threatening conditions also can be well treated with homeopathy. So with this, If anybody wants to add, please do. Otherwise, we will conclude for today.
I just wanted to express my gratitude for the patients who teach us, such lessons and who give us confidence to treat such cases. A person sticking to you in such a condition is really, I should thank him for that, because that gave me experience. And immediately after a few days, I got second case of GBS, which I diagnosed on the second day. And again, deep acting remedy helped me, and we will be presenting that case. We will focus on the remedy in that case. So thank you, friends, for helping me to complete this presentation. And thank you everyone for watching.
Thank you.
Thank you.
Thank you.
Yeah. Bye-bye.